We at AHI often support interns over the course of the summer or over a course of a semester, and we structure those internships to be linked to work that AHI is doing, but also an independent research project, so that our interns have access to everything that we're working on and can ask questions about it, be involved in it, but also have something that they can focus on intensively for the period of the internship, and explore new ideas that come up only because we're working with them, and that's exciting both to them and to AHI. So we had 2 interns with us this past summer who were working on our nascent and growing health secure housing initiative, which we've been building since mid-March or so, when COVID first was acknowledged as a major issue in the US and started to be acknowledged as an issue that was going to touch on housing, not only in the US, but globally as well. So Andrea is a master's student at MIT in the Department of Urban Studies and Planning. I personally like bringing in MIT master's students as interns because I was there, and it's always a great program to get involved with. And there's a real focus on international development as part of that program, as well as community development and housing. And I think one of the things the program does really well, and why there's good synergy with AHI often, is that it does take this holistic look at issues and how they can be applied in different contexts, and how they affect different contexts differently, and then what the response has to be. So without too much further ado, I will hand it over to Andrea to talk about her research and how health secure housing plays out in Latin America.
Thank you so much, Anya. Hi, everyone. So my name is Andrea, just like Anya mentioned. My allergies are really bad today, so I apologize if I sound a little stuffed. It's not the greatest day to have bad allergies, but here, this is how life is, right? So anyway, thank you everybody for being here. It's just great to see some of the faces that I worked with during the summer as well. So yes, I'm very excited about being able to share this research with everyone else. If you give me just 1 second, I'm gonna get the presentation started. Let's see.
And while Andrea is setting that up, I also forgot to mention, just structurally, Andrea will do a presentation. I have a few comments in response to get a conversation started, but really we want these discussions to be an open discussion among everyone. So we will devote as much time as practical and look forward to your thoughts and questions and input as the hour goes on.
Here, can everybody see it? Well, okay. So this is my presentation. I worked during the summer on this concept of health secure housing that AHI is pushing forward, and I tried to implement it in the context of Latin America's informal settlements. My sort of like expertise, or what it is that I'm speaking from in this particular topic, is for the last few years, I worked for the city of Winnocitis, for the government of the city of Winnocitis, something similar to what we would call in the US the Housing Authority, and I was part of the a slum upgrade project and a relocation project in the southern part of the city of Buenos Aires, linked to to contamination displacement in this polluted river. So that sort of like introduced me to a lot of the issues that facing the different informal settlements. I became part of a larger network of people working in informal settlements in the city of Buenos Aires, in Argentina, and also in the rest of Latin America. So that's sort of like where most of this research builds on. So how can we actually adapt this idea of health secure housing into Latin America, into low-income informal settlements in particular? So people, if you've been part of these webinars already, but you might have heard, David's big phrase is kind of like, once you're inside your home, you're safe, and that's how we're trying to push health security forward, right? Like, it's a safe space, where within the context of a pandemic, you and your family can remain safe, right? But the problem with when we're trying to expand this to Latin America is that in the informal settlements, not every household is actually able to isolate and to do so safely, right? That does not mean that we shouldn't be looking towards other ways of implementing health security. So the very important thing is that this research is mostly speaking towards slum upgrade projects and towards development projects that are pushing for housing, for home improvements within informal settlements. So what are some of the things that these projects in particular should be taken into consideration when we want to expand the frontiers of health security into slum upgrade projects, right? And this is not like, I would like to acknowledge the fact that many of these projects are already working on some of the basics, which are how to provide food security, how to make sure that electricity is available and that water is available. And none of the things that I'm going to talk about are useful without that other conversation happening first. But it's already, you know, the World Bank and the International Inter-American Development Bank are already having quite a lot of projects in the region trying to push these basic necessities improvement forward. So this is sort of like taking it a step further and trying to think about what is it that's going to make these communities safe. So just some important context, 20% of Latin America lives in slums, right? And so particularly in Latin America's largest cities, which are highlighted in this beautiful map, where we see just to try to understand the magnitude of the issue. We're not talking about the livelihoods of a few people, we're talking about millions of people who live in informality and who are greatly impacted by the pandemic. So in terms of like our unit of analysis, I'm focusing on this concept of community, right? So we tend to think, I'm a city planner, and we tend to think in, you know, we have the individual houses, we have the neighborhoods, and we have the cities, right? And what I'm thinking about in particular for these applications, the concept of community. What does that mean? It's not, and it came out in a previous presentation, where it seems a little counterintuitive to have the community within the neighborhood, but the truth is that in Latin America, many of the informal settlements are housed within other different neighborhoods of the formal city, right? So we're having, for one example, in the city of Winnocitis, the neighborhood of Retiro, which is a larger neighborhood, and within it you have the community of La Villa 31, which is one slum in particular. So thinking about these smaller communities is sort of like how we're trying to compartmentalize the way that we can act upon the issues of informal settlement. So one of the things I was talking about compartmentalization, but this is actionable distinction of urban spaces, right? This is sort of like how do we need to create these units, so we need to understand these physical geographic units that sort of like would allow us to fight the spread of the disease. This is also thinking in terms of COVID-19, but in terms of future pandemics as well, right? So creating these health secure spaces that would somehow reduce mobility and increase opportunity within the locality, right? Trying to prevent unnecessary traveling from certain parts of the city, and not in a way, not trying to push for some form of segregation, but actually thinking what is it that we can sort of like locally, economically develop to try to push this concept of slum upgrade forward, and also health security in the context of the pandemic. So these will be our health secure communities. So my proposed approach to health secure communities is based on 4 sort of like pillars. The first one is the healthcare accessibility, then local business development, employment security, and infrastructure for remote working and learning. What do I mean for each one of them? In terms of healthcare accessibility, the idea is to be able to design healthcare systems that are community oriented, that are affordable, and that are physically accessible to community members. Again, we're thinking in terms of locality. How do we make sure that people are able to remain within the context of the neighborhood and satisfy their needs within the context of the neighborhood? In terms of local business development, how do we stimulate economic sustainability of the area? How do we focusing on entrepreneurship, small business development, and local consumption? In terms of employment security, we understand that this is sort of like a bigger scheme. This is something that needs to happen hand in hand with federal regulations and with city governments as well. But precisely because our audience for this research is slum upgrade programs, is that we want to make sure that they are also incorporating this pillar into their projects. But it's how do helping promote paid and sick leave, paid sick and family leave. And sort of like to acknowledge the importance of care, right? Particularly with a focus on women, their role of being caregivers for their families and for other people that they support in their community. And then finally, the infrastructure for remote working and learning, sort of like how can we start thinking about internet and access to internet as a basic necessity in order to make sure that people who live in informal settlements are not left behind or are not sort of like unable to access work or education because they don't have access to internet. So I'm going to go in depth a little bit into each one of these topics, and I'm going to give a couple of examples. So in terms of healthcare accessibility, one of the things that we have identified as a possibility is to sort of like uplift the already existing healthcare community networks. There are many of these places already have somewhat informal, but establishing community networks, and Islam Upgrade projects should be able to tap into that local network and to find ways to promote it and to make sure that, for example, like our third steps suggest, design spaces for community healthcare practices, right? And in this process, you would also be supporting the role of community health workers. So the example that I have for this in particular is in Villa 31 in Buenos Aires. They have this educational sort of like compound that it was built during the Islam Upgrade project. And one of the things that, they sort of like repurposed this old, like it's in the port area of the city of Buenos Aires. So this old building, they repurposed it to become a school. And during the pandemic, it was actually used as a hospital for many of the families that needed to get tested or for isolation purposes, as well as they were trying to contain the spread of the disease within the slum, right? So that's kind of like a space that was useful for that. At the same time, in order to do this, both the authority that's in charge of the slum upgrade and the IDB officials that are supporting this intervention, they really made use of the community health workers, the women that are already working in the area, sort of like as we call them promotoras de salud. So like basically going around the slum and helping people with, contraception or like different things. This is the work that they used to do before the pandemic. During the pandemic, it was repurposed to make sure that people were getting tested, that they were receiving food support while they needed to be isolated and stuff. So that's sort of like a good example of healthcare accessibility. In terms of local business development, what we propose is that it's important to promote the local entrepreneurship of all kinds of goods. People should be able to access not only food, but if they need to go to, they need to go to the pharmacy, or for Advil, or if they need to get to fix the lighting in their house, and like an electrician, the small businesses that sort of like make a neighborhood a vital space. So those are the kind of things, those are all sorts of goods should be promoted within the context of informal settlements. To do that, we need to design spaces that accommodates the needs of small businesses with little resources. It's a reality that in many informal settlements, particularly the ones located in central areas of Latin America's mega cities, land is scarce, so they do have very little space that they're working with. So how can we design spaces that accommodate those needs? And finally, motivate local consumption, right? Like if we're able to have all kinds of businesses within the area, and they have the appropriate design for their needs, then we're going to be able to motivate local consumption. One example is Algarramo Almacenes. This is an initiative that was born in Santiago de Chile, and they actually help bodegas in the informal settlements sort of like rearrange the physical space to make sure that they're able to sell in bulk and to reduce the costs for the local families. In terms of employment security, where we want to focus here, it's first protecting the health of those who care for others, which means protecting others too, right? There are a lot of women living in informal settlements that work as, sorry, I'm getting my languages confused, but that work as, I forgot the word for empleada. They're working as maids or as sort of like supporting people in the formal city, and while doing that, they are sort of like accessing public transportation. They're moving around the city, so they themselves could become sort of like a vector of disease, while they're actually a fundamental pillar for these families to get care, right? First, for the families that they're working for, how, you know, a lot of families, particularly middle and upper middle income families, really rely on having a person helping them take care of their children. So to be able to work, and more in the context when you're unable to like provide daycare or take your children to school, so then they really depend on this. But at the same time, this woman's families also relies on her for their source of income and for their own care, right? So how can we make sure that we push forward some the importance of protecting health, of protecting workers, and then at the same time, we need to rethink these wet and dry encounters for people who work within the informal economy. One of the examples is creating those, implementing more widely those protective sort of like plastic, transparent plastic sheets, and that's gonna sort of, particularly in the context of markets, it's gonna help people not having to really be exposed so much to the disease, right? So how do we, slum upgrade programs should be sort of like pushing for this infrastructure, which seems easy to be placed, and that at the same time it's going to become part of the assets of the community later on. Finally, remote working and learning infrastructure. So one of the things, as I mentioned before, we need to think about how internet has become sort of, access to internet becomes a basic necessity as well, right? And having a conversation with someone over these, they were, you know, they mentioned, well, we can't think about internet when people are unable to access water, and that's true. I think it's a valid question, but the thing is, we need to be thinking, it's like, okay, people, if schools are mostly remote, are working remotely, then students, there's a large amount of students that are unable to access, to be able to do homework, to be able to stay connected with their classmates, to submit any sort of like projects that they need to be working on. So all of the students who used to be part, you know, they were going to school in the formal city, and they were sort of interacting with students and with people who had other resources than they do. Now they're unable to sort of like stay on track on their educational path. So we need to make sure that internet is sort of like considered a basic necessity, and we need to push for the improvement of internet connections. At the same time, in slum upgrade projects, one of the things that has become relatively normalized is that we tend to build smaller units, right? No more than 40 square meters, and we tend to have, because we're just thinking of the home as a place to be while people are working and studying outside of the house, right? But if this is not true now, then we need to make sure that there are going to be some the design of home improvements is going to allocate space for these remote activities, whether it is in some sort of like shared spaces within a few families, or actually thinking of changing some of the designs of the home improvements and the public housing that's being built for informal settlements. The example that I'm bringing here in particular, it's a regional initiative that sort of like does community mapping of areas where there is poor internet, and people do not have access to it. And if you zoom into each one of these, as you get closer to the bigger cities, it's mostly in informal settlements where you're going to find that people are unable to connect to the internet. So there is a connection there. So to sort of like bring this to a closure, I think something really important that we need to push forward with these initiatives is that we're thinking about the developing community resilience, right? And I found this really beautiful quote from the Post-Carbon Institute, where they're talking about the power to envision the future of the community and build its resilience resides within community members, right? So what does that mean? That we need to be able to support communities as they are as they are going through the pandemic, but we need to be able to do it in a way that we leave infrastructure that sort of like adds value into the community and strengthens cooperation, right? So that's why our particular sort of like the person that we're speaking to is people who are in the slum, who are, you know, the World Bank, the International Development Bank, and the different financing entities that are helping with slum upgrade projects. These are some of the things that we need to be thinking of when we try to tackle the middle term and like long-term effects of the pandemic in Latin America's informal settlements. So yes, that would be my presentation, and I think Anya, it's your turn now again.
Great, thank you, Andrea. That was fantastic. Lots of food for thought there in many different directions. A few things that stood out for me in terms of this line of inquiry related to the other work we're doing in health secure housing. I think the focus on the community aspect is a different way of looking at this, and very important. And I think it's, it has come to us through your investigation of the informal settlements and understanding the dynamics and essentially the amount of sort of the fluidity of barriers that is necessary for survival, to be frank about it, in many of these contexts. But it also is something to think about in not just informal settlements, but formal settlements in many different places, in public housing projects in the US or elsewhere. And just generally kind of thinking about what are the communities and what are the necessities of those different communities or populations when thinking about health secure housing that we need to consider and work for. And certainly since you started this research, the discussion of COVID and the impacts of COVID and what that's going to mean and how we're going to recover or when have changed and evolved over the last several months. There's lots more talk of there possibly being a vaccine sooner rather than later, which was somewhat unfathomable when we started this research. But at the same time, there's only so much production capacity once that vaccine exists in any particular case, or a couple of different vaccines exist or whatever. And so the dynamics of who's going to have access to that and how quickly different communities, different populations, different neighborhoods are going to be able to, quote unquote, get back to normal, which is personally a phrase I never like to use because you never get back to something. You're always adapting or evolving into whatever the next new normal is going to be, that's going to be different. And we're going to need to take that into consideration. And unfortunately, the reality will be that these communities that you're looking at are likely to be very much last in line for any kind of preventative measure that will minimize transmission in that way. And so thinking about these other hyperlocal solutions, these other approaches to how do you make a community functional in the context of having a health risk present is really important. And there's a lot of need to get that right sooner rather than later, and get that right now and start thinking about that right now. And it's also not divorced in many of these neighborhoods from challenges that they face all the time. Certainly some of that is addressed through water and sanitation work in the development sector. But there's, in some ways, this reality of risk is something that these communities are much more accustomed to than, say, New York City was, or Boston was, or communities in the quote unquote developed world or Western world. So I wonder, I guess one question that comes to mind for me is, are there lessons to be learned? And did you look at them or think about them of how these communities are already or have adapted to living in essentially chronic risk environments, and how can that be applied or built upon to increase their security going forward, and possibly be lessons learned that can be applied to other communities that haven't thought about it, or neighborhoods or buildings in other contexts?
Yeah, that's a great question. And actually, this concept of risk, the idea of focusing on resilience comes from understanding that risk is not something that it's new for these communities in particular, right? Risk and risk has many layers, and we can look at it from many complex ways. But in the context, particularly of informal settlements, there's always an element of risk. There's always an element of precarity in terms of like, how long am I able to? Will I be able to live here? How long? Sort of like what access will I have to jobs? What access will I have to education for my children? So there is a lot of that. Those risks are always present. particularly in the context of global warming as well. Waters are rising in many of these cities. They tend to be coastal, or they that sort of exposure. So there's a lot of that going on. So this is why the focus, particularly in terms of like the theoretical aspect of my argument, was, okay, we need to focus on community resilience, right? This is nothing that having to overcome difficulties such as these is not, it's nothing new for these communities, right? It's something that they've been doing historically. But particularly, I think two great examples as the pandemic developed in Latin America is the rapidness with which the communities were able to respond to the lack of food, right? As soon as people stopped working, they weren't able, they didn't have as many disposable cash, so they weren't able to sort of like feed themselves in the same way. And there's some, actually, like 2 or 3 weeks ago, research came out from some people at UCL who looked at how rapidly then these networks expanded to make sure that both community development organizations, with some help from the state, were able to ensure these that people were getting access to food, right? I think that was kind of like the very first quick response that people were providing to this issue. So yes, this concept of resilience is already existent there, and adaptation to risk. And this, I know it happened in Latin America, but from attending a seminar by the Mahila Housing Trust, I know it also happened in the slums in India. So it's a reality throughout the world, I would say. Yeah.
Right. Well, that links to Matt's question that he's put in the chat. Matt, you want to elaborate on your thoughts there? And we'll open this up to a discussion, so feel free to add.
And I have a couple of questions on private that I want to address as well. So
great,
yes.
wonderful.
So I'll be quick. Andrea, great job. Fascinating. As someone who's very domestically focused here in the U.S., I learned a lot from you, and look forward to continuing to engage in your work as you progress. My question really is around, I'm really interested, obviously it's relatively easy to look at the property level and kind of go upward from there and try and bundle together resources, which at least here in the US is how we typically operate. Again, I'm relatively ignorant about other countries, but I was thinking about, that wonderful diagram you presented us about neighborhood and community especially, and figuring out how we can bring resources into kind of a higher level above the property level, but they can be responsive to these hyper local solutions. And what your thoughts are and where those resources could be directed. Does it have to be NGOs, or could it be some form of governmental organization at the hyper local level? And just one example that comes to mind, again, here in the Washington, D.C. area. So obviously Washington's not a state, it's a city, but then below that we have what are called ANCs, Area Neighborhood Commissions, which are I would call hyper local in kind of at the neighborhood level. They're not, I think, structured to be administrative bodies, but they're very in touch with the community and the people and the resources and probably the solutions that are best available. So I'm wondering if there's something like that that you see as the best place for these types of resources to reside.
Yeah, that's a great question. So I'm going to speak about Buenos Aires because that's, of course, the reality that I'm most familiar with. But I do know that, for example, in the case of Lima, Peru, and in the case of Rio de Janeiro, like it's somewhat similar, right? But you also have you have the city, the entity of the city, but then you have these sort of like, in Buenos Aires, they're called comunas, or you have smaller districts within the city, right? And those, they have their own sort of like political representation, and they have their own budget, I guess, and they're able to work in, development projects that are related to that specific smaller neighborhood within the city. What I have seen, though, is that the issue of informal settlement, so like how to sort of like improve the particular informal settlements, tends to be tackled at the city level, right? Like it's still not sort of like a smaller regional hyper-local, what you were saying, like hyper-local understanding of it. And I would say it's probably linked to where you can actually pull more resources from, right? Like and it's more, if if the governments and different governments in Latin America have different approaches. Some of them tend to be more pushing for a policy of improvement, and some other governments are thinking about expulsion, right? So that's also kind of like another challenge facing this particular working with this particular community. But one of the things that that happens is that you have specific government entities that are thinking about the issues, because informal settlements will have very particular issues that are not always the same as the rest of the formal city. When you create that distinction, though, what happens is that you somewhat prevent the cohesion of the area, right? Because you end up sort of like, okay, it's smaller, we need to work with these, and how you know, the boundary is very clear. How do we make sure that there is some form of like, you know, cohesion with how the rest of the city is working? So I think, you know, it's important to sort of like find different ways to particularly for these neighborhoods to sort of acknowledge the fact that, first of all, acknowledge the fact that there is an informal settlement, that it's part of the neighborhood as well, right? And how that can be translated to the way that funding works from international organizations and from local governments as well. So yeah. I see a hand up, and I did have Mamadou. I don't know if you want to ask your questions.
Yes. Thank you, Andrea, for this nice presentation. My name is Mamadou. I'm calling you from, or I'm attending the meeting from Dakar, Senegal, West Africa. I'm trying to see some similarities between informal settlements in South Africa, in Latin America, and in somewhere in West Africa. I know the scale is not the same. You know, I saw the size of the cities in Latin America. They're talking about 1 billion. But there are some similarities. So my question is just two small questions. The one is, was the study conducted during the confinement? Was it a locked-in period? And second question is, what is the historical fact of the settlement? Was it a new settlement or a very old informal settlement? Because it can make a difference. Yeah. Thank you.
Yeah, those two are great questions. So at the beginning, when I started in June and July, particularly during the month of June, there was a huge spread of coronavirus within informal settlements in the city of Buenos Aires, which was much bigger than what's happening in the rest of the formal city. So when I started this research, it was the hot topic, right? And there were locked-in measures in place, right? I think towards halfway through August, they began to be a little bit more flexibilized in the city of Buenos Aires, and not because the disease was contained, but because people couldn't take the lockdown anymore. So that's also another issue. Today, what you're seeing is the numbers, or a month ago, to be honest. That's the other thing with the pandemic, like it changes so fast, right? It's very easy, it's very difficult to make definite statements because of how fast it changes. But a month ago, the numbers in the formal city, the number of cases in the formal city was growing very rapid, while in the informal settlements, the spread of the disease had slowed down. This is for the city of Buenos Aires. And today, the city of Buenos Aires is sort of like reaching the peak has passed, but the rest of the country is very affected. So that's the other thing. And also that sort of changes the priority of the national government and where they want to be focusing on, where they want to be putting their eye, right? But when we first started, yes, there was a complete lockdown in the city of Buenos Aires and the metropolitan area. But at no point people were sort of like mandated to stay at home in informal settlements. And that was kind of like a decision the government made, where they thought, we can't ask people to stay within the context of the house. So they were allowed to move in within the neighborhood unless they had symptoms and they had, they were testing and waiting to get the results. So yes, there was a lockdown. In terms of like the historical relationship, the one that I showed a couple of pictures from, that one has existed for about 100 years. And it's historically been a neighborhood where first Italian and Polish migrants settled there because they used to work it's right next to the port area in Buenos Aires. They used to work there. And then, and now today you have more sort of a Bolivian and Paraguayan and people from other parts of Argentina moving there, who are still sort of like servicing the downtown area of the city. So it's a historical neighborhood, that one in particular. Another one that I did a lot of research on, which is called Villa Azul. It's in the outskirts of Buenos Aires. And that one, it's a little newer, but it's still been going on for around 40 to 50 years. I guess in the case of the newer settlements, then you would probably see, because the local networks wouldn't be as strong as the ones that you have in neighborhoods that are already, communities that have already 100 years have been settling in that area. So then, yes, you do have a difference between that, but because they are all settlements, they also have, relatively strong political power. They're able to say, they're able to sort of like have this discourse of like, this is where we live, this is where we inhabit, and this is the services we provide to the city where you're all living in as well. So, yeah.
Great. You said you had a couple other questions that people had sent you.
It was Mamadou's.
Oh, it was Mamadou's question.
Yes.
Perfect.
Yes.
Yes, thank you, Andrea. Thank you.
No, thank you for the question.
Other thoughts? I see we have people from several different countries who I recognize, and a few people I don't know where you're calling in from. So how does this relate to context of work that you've worked on, or questions that come up for you in that, or places you visited and seen circumstances that factor into this discussion? Anyone else have thoughts?
Well, this is Matt again. I'd say this is one of the things that coming at it from at least a highly developed nation, the US Western perspective, where I actually see a lot of advantage in the less formalized economies and structures that we have here to some extent, because I think back to how telecommunications evolved wireless telecommunications over the last 20 to 30 years, where it seemed like a place like the United States had such a technological advantage, but we had the legacy of incumbent companies and regulators and policies that I think in many ways didn't get a lot of the benefits out of wireless mobile communication that a lot of emerging economies received, around digital payments and things of that nature, and innovation that evolved that couldn't happen here in the United States, despite our, sophistication financially in terms of policy. So I'm wondering whether we can really look to the favelas and other places that have different physical infrastructure and social infrastructure than in the United States or Europe or Japan, but that actually can kind of leapfrog solutions because there aren't the same impediments. They lack some of the resources, obviously, but they also don't have the barriers of incumbents and the way we do things. So, Andrea, I don't know if you have some thoughts on that.
It's a good point to try to think about it in those terms. The issue with informal settlements, or the issue that they're currently facing, is that for so long they've been considered something that needed to be completely eliminated, right? They needed to be eradicated, and the policy for many years and for decades has been to eradicate. The housing is the housing does not have good quality, which we're not going to deny. The services are not provided. Again, we're not going to deny any of that. So it's true. Like they're not sort of like the best place to live. And when you're trying to raise the standards of your community, then you think of it as an issue and something that you need to target or somewhat eliminate, right? What happens is at the same time that there is a huge housing deficit in these cities, right? And people are coming to these cities because that's where jobs are, and that's where the economy, where they see economic improvement or a possibility of that. And you don't have housing that sort of like provides that caters to their needs, right? So then at the same time, these informal settlements are somewhat providing the space that both the market or the state are not, are sort of like not doing it. So I do think that it's important to try to see how we can work with the informal settlements, right? Like how can we better understand the way that informal settlements work, both in terms of like the social networks, but also the economic reality of informal settlements, and not in a way that it's trying to change it, but actually trying to incorporate or for it to become an accepted reality, right? Like acknowledged reality of the area. Because if we're talking about millions of people now, it's not like you can just come and wipe them off, you know. If you do so, you need to be able to provide services for them in some other way, and it becomes so expensive that it's actually impossible. And it's, on the long run, it may not even be realistic to think about, you know, tear down a settlement and build housing for everyone. How are they going to pay for their housing? How do you make sure that in the long run they're not going to build another informal settlement because they're unable to even pay for formalized housing? So there's a lot of thinking in terms of like questioning the existing structures that need to take place, and I think that goes sort of like hand in hand with what you're saying. Like how do we make sure that and this is why I want to talk to the slum upgrade projects in particular, because they are the ones working, you know, sort of like thinking and in structures and thinking about how much money needs to be put towards developing this area. So how do we make sure that they are not erasing some of the current reality in a way that makes it impossible to work with on the long run? So, yeah.
Another thing that came to mind. So you were talking about how Villa 31, you know, has been around for 100 years and started as, you know, essentially the working poor of a particular generation and a particular ethnic or, you know, country migration pattern, and that's shifted over time, essentially, as migration patterns have shifted over time. And it's still, as I understand it, very much a community within this neighborhood that is the workforce of the city in many ways. I wonder how much, you know, an opportunity there is. Certainly in the time of the lockdown, it probably became apparent to a lot of people that they didn't have the workforce available to them that they used to have, or they may not want to, whether that's service jobs in a house, whether that's, you know, in other contexts, more formal employment or otherwise. I wonder how much opportunity there is to tackle some of these challenges and some of these questions about building security in linking that insecurity to, you know, into, I'm not sure that was clear, but so in terms of like the formal part of the city that relies on a set of workforce, and having them acknowledge that their workforce is insecure because of these other factors, and what can they do to help stabilize, whether it's the living conditions or otherwise, so that their lifestyle is not impacted down the road by it. It's a little bit of a cynical take on how to approach the question. But have you seen any of discussion about that, you know, within Buenos Aires or otherwise?
Yeah, there is actually a really nice documentary from Brazil, from Rio de Janeiro, from Sao Paulo in particular. And in this one, Informal, they follow the lives of domestic workers, and they, you know, sort of like, since the pandemic started and some services were reduced, like how difficult has it become for them to even commute to the place where they work. So if they used to leave at 5:30 a.m. and walk to this bus stop and then take this bus and this train to get to this downtown where they're gonna work with this, now in order to be able to be there by 8, they need to leave at 4 o'clock in the morning. So what does that mean for the life of this particular woman? What does she does with her children as she's, you know, she needs to leave early the house, and also if her, you know, her employer, and that's what I really liked about this documentary, is because they also interview her employer, who is a middle-class woman who works at a company whose job hasn't stopped because of the pandemic, and who really needs someone who's going to support her in order to be able to go on with her life, right? So yes, I think, you know, you're saying it's cynical, but I think it's a reality, you know, it's a reality that cannot be dismissed, that you have people who live in informal settlements and who work in the formal city, and who are, to a certain extent, you know, the backbone that allows for many other services to continue happening as well. So there definitely need to be an acknowledgement of that. And it's not easy because it's, it's complicated. It's never as straightforward as that. But I think being able to put it in economic terms sort of like pushes the argument forward, you know, and it pushes, help people understand, particular decision makers, that if we don't find ways to protect the security, the health security of these communities, then the impact on the larger city is tremendous. And yeah.
Monty, I see a great question in the chat. You want to elaborate?
Yes, thank you. I'm familiar in other developing country contexts of things like savings and credit groups that really foster collective effort within communities. And those savings and credit groups give rise to other kinds of collaborations that meet community needs in ways that are beyond the capacity of an individual or an individual family to acquire for themselves. So I'm wondering if there's sort of a tradition of community cohesion that can give rise to this kind of collective effort to meet some of the community needs that would be beyond the needs of individual families, such as, you know, collaborative entrepreneurial enterprises, or childcare programs, or access to computers and internet access.
Yeah.
Again, that would be beyond the means of individual families.
Yeah, yeah, that's a good question. I think what's important to always remember that there are community organizations within the settlements and outside of the settlements that work within the settlements that can be considered nonprofits. Sometimes they're smaller than that, but they have for decades now been thinking about the particular needs of this community and how they can sort of like expand this social cohesion, right? I think speaking of it in terms of social cohesion, it's a great point. I think what sometimes happens in Latin America, or what it lacks, is that the sort of like the business sector does not see social entrepreneurship as a sexy thing, right? Or like does not consider it to be something that they could be investing in, and somewhat trying to bring I'm remembering one particular intervention where we were surveying for the city of Buenos Aires. We were doing a survey of local business, so small businesses within one particular slum, a small 900 family settlement, like a relatively small settlement, and you know, we were trying to understand, okay, where is the tailor and where is the bodega and where is like all these different places. And to do that survey, we invited people from like the Chamber of Business for the city of Buenos Aires, right? And it seems like it seems again kind of like, okay, what is the point of this? But it's to try to make people understand that there is a way of working with this economic environment as well that is positive for you as well, right? So to try to bridge the gaps between who are, you know, managing banks and doing bigger businesses and the people who the smaller entrepreneurs, to try to see if down the road or in the future you can create more of that sort of like more of that connection or that social cohesion to at least to try to balance out some of the inequalities. Yes, that's a great point.
Thank you.
I had a quick maybe like a closing comment / question for pretty much everyone on the webinar. It's more of a larger picture vision that is, I'm just thinking in formalized settlements versus informalized settlements. In comparison, is it like, should we have the benchmarks for health security the same for both kind of settlements? And I'm asking because the approach to that is very different in terms of response as well as in terms of characteristics of the settlement itself. And I would like, why I'm saying this is because I'd like to point out the the Dharavi case in Mumbai, India, where it's become almost herd immunity there, and the lack of medical services, healthcare services, the lack of proper testing, but the prevalence of confinement in an area sort of helped that herd immunity. Yes, it was a coincidence. Yes, it was luck. But I was thinking if that can be an approach, like a controlled approach towards managing such contagion in informal settlements. So, like, have you seen or have you read more of such alternative approaches to managing such pandemics in an informal settlement is what I'm trying to ask. Instead of going through and having the same benchmarks that we look for in formalized settlements, is there another way to look at this?
Yeah, there was a study done by the health ministry of the city of Winnocitis, where they did zero prevalence tests for the people in the Villa 31, and it came out with something like 58% of the community had COVID. So it's much higher than what, if you compare it with what happened in other places. But then they did the same study in another informal settlement that had this form of like community isolation, and they had 14% of the community actually tested like positive for the zero prevalence test. So then, yes, I think it's a challenge in terms of like, should we expect just these, because I think where the argument can go is like, okay, should we just expect the disease to sort of like travel in these communities and then hope for the best? And it's a younger population, and in the formal city, it's so they will be able to deal with COVID in a different way. The thing is, okay, this is the particularities of COVID, but if we are, if we're thinking of an era where pandemics may become more frequent, and they're all going to have differences. So it's like, to what extent do we not end up kind of like, again, reinforcing isolation from a negative perspective if we think about it in those terms? I think it's a great question. I think we should. I do agree that we should have different benchmarks. I think that the focus should be on the time frame, right? Like, is it a short-term goal, or is it a longer-term goal of how we should be working with informal? So yes.
Yeah, I think to build on that, that's a great question, Sanjana, and it is, Andrea, your approach is saying, there's a way of looking at the specific to COVID and the specificities of COVID and how it spreads and how it affects different populations differently, and et cetera. And, that's one set of strategies. And then there's this larger question, which I think is what sort of our health secure housing initiative is looking to address and working on. That is, it's not just COVID. It's maybe another pandemic. It may just be underlying health issues that affect some populations more than others, but that we've come to realize, we as society writ large have come to realize over the past 6 or 7 months how much health elements affect the functioning of day-to-day life in a lot of other ways. And within that, how much having a secure environment to live in, and secure can mean a lot of different things, but also a health secure environment to live in is important as a foundation to that larger functioning and that larger approach. And then on top of that, how do you adapt based on whatever that threat or new risk is? And I think, yes, that all of those elements are, while they have some universality to them, are also very specific to the place, to the systems, to the populations in any particular context. And those benchmarks do need to be appropriate for that, because if we're going to be looking at what our solutions are, looking at what the action is off of a set of benchmarks, you need to make sure you're measuring the right thing to be taking the right action. And that's, I'm just adding complexity to the whole thing with 3 minutes to go, which may not be fair, but that's a lot of what we've been working on and what we've been playing with. And I think is key and is key for this topic of discussion, but is also something that we address in other contexts of affordable housing and the many different contexts we work in, and what's appropriate for what context, and what, you know, what is the actual problem that we are trying to solve, and therefore what is the right solution to solve that problem. And that's going to be different, even if the principles are similar in different contexts.
Yes.
So, are there any other last thoughts or questions from anyone? As always, lots of things to think about over the course of a short time period. We love having everyone join us for these conversations. We expect to keep doing this. It's an opportunity that we had not really taken advantage of prior to the pandemic and all being home, and realizing that, oh, we don't have to think about the lunch brown bag and only the 6 people who happen to be in Boston. But we can really bring in our community from around the world and grow our community in that way, because there are lots of people out there with lots of great ideas that are all working towards the same goal, or similar versions of the goal. And as AHI, we like solving the problems, but we also like being a convener of people who solve the problems and want to solve the problems, because that's how you get more good ideas and how they spread. So
I just want to offer up a round of applause for a summer of really hard, relevant work. So
absolutely.
Thank you. Thank you so much. Yeah.
So yes, thank you to Andrea, and thank you to all of you for joining us today. Noah has dropped into the chat the link to subscribe to our newsletter if you're not already on it, so you can stay up to date, as well as the link to donations, which you are welcome to share with anyone you know who might be interested in supporting our work. We, as AHI, are a nonprofit, though we function largely as a consultancy firm, but the way we're able to bring on interns like Andrea and do this groundbreaking work is through the philanthropic side of support. So that support is great in monetary form, it's great in intellectual form, it's great in questions that come our way. So thank you for being part of the AHI's community. And I'll let you all go on with your day, whatever time of day it may be where you are.